Welcome back to Bald Talks, the show where we tackle the tough conversations about hair loss and celebrate the beauty of being bald. I'm your host, Felicia the Bald Chick, and today we have a very special guest, a true expert in the field of dermatology, especially when it comes to the unique needs of Black women's hair. Please welcome Dr. Felicia Ekpo, also known as Dr. Edges from Garland, Texas. Dr. Ekpo, thank you so much for joining us today on Ball Talks.
You're very welcome, and thank you so much for having me.
So let's dive right in.
Sounds good.
What are the most prevalent types of alopecia you see in Black women? And are there specific subtypes or patterns that are more common within the demographic?
Yes. So one of the most common, just more so specific to Black women, it would be CCCA, which stands for Central Centrifugal Cicatricial Alopecia. Of course, the overall most common, that's in all hair types, is female and male pattern hair loss. So androgenetic alopecia, but specifically to Black women would be CCCA. And so with that, that's more of a scarring type of hair loss. There is more of a, and I know we'll probably touch base more based on this later as well too. This has more of an autosomal dominant type of picture. So there's a genetic aspect to it, but then also hairstyles can worsen and exacerbate this as well too.
And I actually have both of those.
So very common. See, you already know.
I'm like, okay, I was blessed with two. Okay.
But that's the thing. Most people feel like when you have let's say a hair loss disorder, they always think it's just one type. That's not true. There are different contributing factors that can affect hair.
Okay. So I just throw this in here. My mom, she's gonna kill me, but my mom also has alopecia. My dad has male pattern baldness. So you know, I'm getting it 1, 2, 1, 2 from both sides. So
And that's the thing. It's very important for people to talk to their family about the types of hair loss they have. A lot of the time, we want to keep it quiet. And because of HIPAA, I can't, if I see multiple
yeah,
family, I can't share, oh, well, your mom has this, your sister has this.
yes.
I just always encourage them, why don't you talk to your family and then really see family history, medical history. And then they'll say, Dr. Ekpo. And I'll say, I don't know what you're talking about. I have no idea. But it's so important because then we can prevent things earlier on for our loved ones.
Yeah, yeah. So beyond genetics, what environmental or lifestyle factors are you finding to be most significantly correlated with the development of exacerbation of alopecia in Black women?
So specifically, let's say, for example, CCA, since that's one of the more common ones. So lifestyle factors, it's definitely the hairstyles that can exacerbate. So, for example, the relaxers, the perms, the braids, the sew-ins, the heat, that definitely exacerbates it. So it's very, very important to try to refrain from those hairstyles, limit those hairstyles, and then also there's other hairstyles a lot healthier. And then also the frequency of washing our hair, because having that inflammation on our scalp and not washing our scalp regularly plays a role in it. I know a lot of people think that the longer you go without washing your hair, the more it'll grow. That's absolutely not true, especially if people have other issues like a yeast on their scalp. All that's doing is feeding that yeast. And then that's promoting more inflammation. So those are two of the main things, just a whole lifestyle change to help prevent that.
And it's crazy because, like I said, I tell people all the time, I've had alopecia without knowing I had alopecia
Hmm.
for about 15, 20 years. And
Hmm.
back then, it wasn't discussed. It wasn't talked about as much as I see it now.
Right, right. I completely agree. And even when it comes to the discussion about alopecia, I think that it's because there's more awareness. A lot of the times people didn't even know that where do you go to get information about alopecia? What doctor do you see? now people are understanding that, oh, go to your dermatologist. But at the same time, too, when it comes to a dermatologist, some people will subspecialize in hair loss. Some doctors may not, but there are doctors out there that feel comfortable with it. So as long as you just open up, then they can always refer you to someone.
Yeah, and just don't slap a wig on it or, you
Exactly,
know.
exactly. No more, don't keep doing the things that are affecting it and causing it.
Yes. So the next question, how does the use of different hairstyling practices, braids, weaves, relaxers, contribute to the various forms of alopecia observed in Black women? And are there specific practices that pose a higher risk?
Yes, yes. So let's talk about that. So some of the two main ones that are seen in Black women are traction alopecia and also CCCA, which is the central centrifugal cicatricial alopecia that we discussed earlier. So now doing certain hairstyles like the braids, the sew-ins, and not braids without weave, more so the tight braids. When you add the artificial hair to it, that's adding more tension onto the hair, more weight onto the hair. That's going to then cause traction. Also with the relaxers, there's actually been things out there that shows that the relaxers can then also cause other health issues as well too. So that's something to think about. But then adding in those things and not taking care of the actual hair itself because we want to do, sometimes people call it protective styles. Not everything is a protective style. We want to make sure that we're not worsening it. And you may not see it then and there, but after some time, you're going to see that tension that you've caused by putting in that weave, by putting in that sewing, the hair is going to get further back, 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 back. And even with CCCA, it's that you'll start seeing the scalp. It may start as a circle, just a small
Yes,
circle. It always, but patients always say that then it's going to affect it and grow more and more and more. I always tell my patients, especially when it comes to CCCA, it's not necessarily your fault because a lot of the times there is that genetic predisposition, but we want to prevent the exacerbation of that as well too by maintaining healthier hairstyles.
yeah, and that was my issue. I saw, just a little small circle
Hmm.
and it started growing. So I was like, okay, I'm just gonna put glue on it, and
Uh-huh.
put my weaves in and braid it and, trying to do something so I can mask it so nobody will be able to see it.
Uh-huh.
But it just got worse. It
Mhm.
just flared,
Right.
to where I had nothing up there.
Exactly.
So
And
then I
that's
had to go to natural and, wearing wigs for a moment until some of the hair started growing back, but not all.
but your hair is beautiful. Like, and you can rock that, your head shape. I wish I had a head shape like that. So it's like my head, nope, it's an
Yeah,
absolute no for me. But for you, like I wish I could have a beautiful head shape like that. My mom would tell me all the time, you know, your head. I was like, but mom, where did I get it from? So
exactly.
I would tell my patients, however you rock your hair, whether it's bald, whether it's short, whether it's long, whether we're doing other hairstyles to make it more healthy, as long as you feel good inside, that's all that matters. But the
Yes,
big thing is, even if you wear a wig or if you wear other healthier hairstyles, as long as we're taking care and treating what lies beneath, because if you just want to just make it disappear, you can try to
yes,
put out your memory as much as you want, but it's the active disease is still going on, whether you want to believe
yes,
it or not. Mhm.
yes. So, uh, are these specific genetic markers or predispositions that are more common in Black women with alopecia? And how can this information be utilized early detect for early detection and personalized treatments?
Yeah, great question. So at Cleveland Clinic, we actually did biopsies on treatment naive, on even patients that have never had anything done to their scalp. And then that's where we saw the genetic predisposition for early CCCA. So that kind of just defeats the notion that when we used to say, oh, okay, well, the person is doing this to themselves. No, there are early markers. So we've seen increase in expression of matrix metalloproteinases, the MMPs, and that because of that increases is one of the biomarkers that increases dysregulation and fibrosis. So think of fibrosis as scarring. So you get scarring around those follicles by the increase in the MMPs, and that's seen in our CCCA patients. Now, with that being said, the goal is that now more advanced treatments will continue to be discovered as we keep doing research. And then also at Cleveland Clinic, we were looking at CCCA and another diagnosis, lichen planopilaris, and the other factors that play a role with it. Now, with lichen planopilaris, that's another form of scarring hair loss. A
I've heard.
lot of the times they it's not necessarily just only key to African American women and Black women in general, but it's actually seen in all types of races and ethnicities. But I think because people don't see it commonly in Black women, or they don't think of it as something in Black women, they usually underdiagnose that. So I see it quite a bit. I'm always on the lookout for any type of hair loss and not just grouping it, but is that's something also to be very, very well aware about, along with FFA. So FFA stands for frontal fibrosing alopecia. That's a variant of lichen planopilaris. That also sometimes gets misdiagnosed for traction hair loss. They'll say, "Oh, I my edges are gone," and now it's because they instead of it just being traction, you can have an overlap, but it's something that always, always, always you should be on the lookout. If your hairline just keeps on receding back up there, and maybe you've done braids, you've done sew-ins and things of that nature, it's really important to not just assume it's just traction, but also be on the lookout for potential scarring from FFA as well, too, frontal fibrosing alopecia.
Okay.
Mhm.
So, um, how can the viewers find a dermatologist who is knowledgeable about Black hair and
Mhm.
alopecia?
Oh, absolutely. So there's different directories that you can go to. So let's say Black Derm Directory has great resources. Of course, I'm here. If you're in Texas, I am happy to see virtually or in person. And I have patients come from all over as well too. And so there's so many things that can be done.
And I will and I will link your information um, in this under this video so you can get some people to come out there and because I've noticed that I'm on a couple of alopecia pages and I've noticed that people just self-diagnose themselves without going to a dermatologist.
Mhm.
And like you said, it could be something else.
Right.
It could just be stress. I'm assuming, I don't know. I'm not the doctor. You're the one with the white coat. So,
But we listen to our patients too. It can be anything, but it's very, very, very important for us to listen to our patients too, because with the hair loss visits, it's not something where you just say, all right, I'm gonna go see the doctor for 10 minutes and then, all right, what's my hair loss diagnosis, doc? It's a in-depth discussion. And the first step is always listening to your patient because you never know there's just from their history. And I like to know from the beginning, tell me everything. What have you used? What have you done? When did you notice it? Just listening to my patients, I'm able to piece together so much. Blood work is necessary as well too, so we can see if there's other internal factors as well too. But there's so many things that play a role. And then tissue boxes. Hair loss is not just all right, here you go, here's your prescription, bye, be on your way. It's something that can affect us all. And just having that person and that team approach so that we know and the patient knows that we're in this together. Baby steps. You didn't lose your hair overnight. We're here for you. And it's the initially whenever my patients will come in for the first time, I can see they're a little bit more reserved. They don't want to take off their hair. And I say, this is a safe zone. And you come in here, you be free. By the second visit, psh, everything's off. I'm like, good. We're no judgment. So it's very important for patients to know that they're not the only ones that go through this. There's so many people that have so similar stories as well too, but just to feel comfortable and confident, and then just knowing that the goal that I have, and then a lot of docs that subspecialize in hair, we want to make sure that we help our patients There's multiple options. Sometimes if it's permanent hair loss, there's different things that can be done, but honesty is so, so important.
So, can you speak on the different types of hair transplant techniques that you offer?
Absolutely. Great question. So, for example, if a patient, let's say they have scarring, or let's say that they have a non-scarring hair loss, let's say female male pattern hair loss or traction hair loss that can't be treated because there's not an active follicle.
Mhm.
That's where hair transplant is one of the best options. There's two types of hair transplants, FUT and FUE. Those are the main types. So for our female patients, since this is geared towards women, for our women, we recommend more so FUT because anyone that's listening to this, a show of hands, depending on if you like to rock your hair short, but if your hair is long, majority of my female patients, if they have to shave all of their lower portion of their scalp, they're not going to be too happy with me. So with FUT, we just take a portion of the back of the donor area, bring those areas back together with a trichophytic closure so they're able to conceal that better. And then that also gives us a larger amount of hair follicles and to transplant into the recipient area. FUE, very similar as well too, except that one does require more shaving. And then we don't have as much that we can transfer, but that can be done. Sometimes multiple transplants are needed. The thing with Afrocentric hair, and that when it comes to Afrocentric hair, it was just at the ISHRS conference. I'm a member of the International Hair Restoration Society. So Afrocentric hair, it's different because we have different types for B, for C, 3, and then people, some of our international members in South America and other places. So Afrocentric hair is completely different types. So the technique that we do for each patient, it varies on their curl texture.
Mm.
So just proper consultation, knowing what to expect, very, very important. But yep, so hair transplantation is also an option. Now, if you have active, and I don't like to say disease, it's just that everything in medicine, whether even if you have let's say, dry skin disease, but I'd say if your condition is active, then that at that time is not the time to do a transplant. So it usually after some months of treatment, and it varies with each person, then we can try a transplant. So I give my patients an option. Sometimes if it's where I prefer to do the chest spot, I'll say, okay, you have a scarring condition. We're at that point where we can do a transplant. And if they are concerned about whether it will take or not, we'll do the test procedure so that now they can see I'm happy with the results. Let's move on to the full procedure. So it varies, but usually patients are generally happy with it.
So, how long does it take to see hair growth?
Great question. So about 6 months, the 4 to 6 month mark, that's when the hair starts growing. We usually require concomitant hair loss visits with me because the thing is, when it comes to hair transplantation, a lot of people think it's like a set it and forget. I got my hair, bye.
Yeah.
No, we still got to keep the hair
Get
and
in the chair without hair, you get out the chair with hair.
exactly, exactly. I wish it was that easy, but we have to continue to keep the scalp healthy. We have to continue to keep the hair healthy, transplanted and non-transplanted regions. So it's a constant process. And we also, especially people with male and female pattern hair loss, which is 85% of Americans, we want to make sure that we prevent the regression of that too, because over the years, our hair follicles will get smaller and smaller and smaller and
Yes.
smaller. And right now, you may not even care, but I guarantee 10 years from now, you're going to care. So my thing is prevention is key. Very, very, very important. Number one.
Okay. So, are there any lifestyle changes that need to be made before and after transplants?
Yes. Please, 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 please. I know as Black women, we love the hairstyles. We love everything. I guilty as well too in the past. So changing the way we do our hair. So please, let's get out of the perms. Um, it's just going to make it worse. You cannot do a perm on your hair post transplant. You're just asking for the same thing to happen again. Getting out of the tight hairstyles And I know as we pay for the hairstyles and then they braid it tight because they want it to look fresh, but it's just a new way of living. We want to promote the healthy hair, and you can still do beautiful hairstyles, but washing the hair regularly, the scalp regularly as well too. And then also safer hairstyles, very, very important. And also one's health. If your blood pressure is not under control, or let's say if you have any other health issues as well too, this is a procedure. So we want to make sure that we keep you in the best overall health so that your hair transplant will thrive. Along with when it comes to smoking, I don't think that people realize the effect that smoking can have on one's body, but that causes vasoconstriction. So basically, the vessels get smaller and smaller and smaller. So if you if you partake in smoking, you don't want decreased blood flow to your scalp. You want to make sure that you get the best blood flow there. So doing those lifestyle changes ahead of time will then prepare you to be ready for transplant.
Okay. I've heard over the years, um, I've heard women say that braiding my hair, and when they do it tight like that, it makes it grow. Like they literally think that tight, it tights and it's just pulling it up.
Yeah, I hear that
So,
all the time.
so I'm assuming that's a myth.
It is it 110% a myth. So now, but I'll clarify it. So not everyone is going to be sub subjected to attraction. So some hair types may be able to take it, but if if your hair is chronically in these styles, then it is going to take a hit. So the tighter the hairstyle is going to cause worsening on your scalp, especially on areas that have decreased integrity, which are one's edges. So it's very important to just the tighter the hairstyles, leave it be.
Okay. So as we were talking, we're gonna do for our viewers a couple of more, hopefully you'll be uh um not a guest, but part of the family, because I feel like, you know, a lot of women cannot afford to even go to a doctor. Um, and they don't get this education as they need. They just don't have that information. So um, like I said, I would love for you to do a couple of parts. You can do some panel. We're going to be doing panel, a guest panel soon.
Mhm.
And hopefully we'll be able to come. I'll be able to come and just see your office.
Love that.
Um, and maybe they can get a hands-on feel of what those treatments that you offer.
Absolutely, absolutely. Because then
So,
starting at home with some of the easy lifestyle things that you can do, that it makes a huge, huge, huge difference.
so I do want to thank you, Dr. Ekpo, for sharing your expertise with us today. This information is invaluable for many women. Remember, knowledge is power, and taking control of your health, hair and health is essential. If you're experiencing hair loss, please seek the help of a dermatologist,
Absolutely.
as um, like Dr. Echo, or if you're not in Texas, she does virtual, and she specializes in Black hair. Not saying that that's the only hair that ethnicity that she takes care of. Um, but again, I do want to thank you, and I
You're
will see
very
you
welcome.
soon. Do you want to let everyone know how to get in touch with you? If you give them the numbers or
Sure, sure.
website.
Absolutely. So what we did with our website, because I'm very passionate about hair, and of course, when it comes to black hair, because not everyone has that skill when it comes to black hair. So God gives me the ability, and I like to share with others. So our website is a huge resource. It has different types of hair losses, things that you can also do as well too. So you can check out thedoctoredges.com. So that's THEDOCTOREDGES.com. And so you can check that out. Also, if you want to and have any questions, you want to schedule a hair loss visit or a consultation, feel free. You can give us a call at 469-809-4247. So that's 469-809-HAIR, 469-809-4247. Or you can go to our website and you can book that feature as well too, straight from there.
I've been all through your website, so
Love it. I love
I've
it.
been stalking you.
I love it. Stock away. Feel free. As long as we're helping out, then I'm good with it.
And to all my listeners and followers, remember you are not alone. Hair loss doesn't define you. Embrace your beauty, embrace your strength, and embrace your baldness if that's your journey. As
Absolutely.
always, remember if life gives you lemons, shave your head and become a statement.
Love
Thank
it.
you, Dr. Ekpo. I'll
And
see you soon.
it has been a pleasure. Thanks for having me. And this is such an amazing opportunity and keep doing what you're doing.
Thank you so much.
Very
Have a good
welcome.
day.
Thanks, you too. Bye.
Bye bye.